On the upper lids, there's some brow asymmetry. This brow is a little lower. Marina, look right here. It's a little bit lower than the other side, although it's not drastically low, and she is concerned about some heaviness to the upper lids. Her background is a little Mongolian. There's a little Asian in the background too, so some of these changes are
So the way I typically do this is I'll make the incision about an inch behind the temporal hairline, parallel to the tail of the brow or a little angle up. I'll just part the hair with an instrument. Press go and make the incision. She was pre-injected. Ask her if she can put it back there. Hey, I'm just marking the upper lids. We finished the other side. Can you guys see?
Guy, could you just show? Can you guys just show us? Can you show us the result of the describe the result of the lateral temporal lift?
Absolutely. If you guys can take a picture from above. So you can see that we just raised the outer brows. She was a bit asymmetric with this side lower, so I gave it a little extra lift. It'll look a little pulled, but that will settle. So we're going
I would say that the medial brow looks like it was elevated slightly by the suspension. Would you agree?
Yeah, so there's this feeling that if you don't release the periosteum medially, that there will be no change. But we have a series of about 100 patients now where we've shown at 2 years out that there are changes in the medial brow just from the temporal lift. When I release the periosteum, I'll release it to the supraorbital neurovascular bundle. I will then do a back cut so it doesn't get tethered so that it shifts this way. And you always get a little bit of elevation here.
I think it's very clear. You can really see it on the table how much medial brow elevation you get without having to release it.
I think that medial brow lift is a very overdone procedure, but that's just my opinion.
No, I think you get medial brow elevation with this technique without doing anything to the medial brow. I think it's subtle and it looks great.
Correct. I'm going to give a talk later today on this exact concept with a large series of patients who underwent this, which I think will demonstrate exactly what you're saying, Andrew. So we're just marking her.
Talk us through your markings right now.
So she has a little bit of Asian background and a little bit of an epicanthal fold. We're not going to modify that at all. I usually use a finer marking pen. I don't mark in the preoperative area because I think after you inject and prep them that you end up getting spreading of the mark. And she just needed a little bit taken off. I don't mind a little bit of lag ophthalmos. I don't like a lot of lag ophthalmos. If the patient has had a history of Bell's or has orbicularis weakness, then I don't allow any lag ophthalmos. And I just connect the dots. Marking pen's a little thick. I'm going to go ahead and do this, and I think we'll do a brassiere suture too, just to show the audience what it's about. And then we'll do her lower lids. It's a straight repositioning. She doesn't really need skin taken off, and she has good canthal integrity. And then I'm going to inject a little fat to the brows too. I like doing that with brow lifts. Okay, can I have some, is this anesthetic?
No. Yes.
1%?
No. Yes.
Okay, how big is this?
Unknowns.
Okay.
If you want to see patients on the website, aasurgery.ru.
Beautiful. So when I inject patients, even if they're asleep, I teach the residents and fellows to bend the needle up. I have had patients jump up on a table. I'll put traction on it. I just want to hydrodissect the skin from the muscle. You can actually then just, if they're awake, push it along so the next injection doesn't hurt. There was a case in Los Angeles of a patient under general anesthesia that had a perforation of the globe. They jumped up during the case. It happens on occasion.
Questions, please.
Now you could
Ask your
use
questions using online system.
you could use this with a, you can do this with a knife, or you can use the Bovi. Is it on pure? Oh, do we have pure cut? The pottery on pure.
Yeah.
Pure.
Yes.
You have an option of pure or mixed. You want pure.